Welcome to this session on community entry, community participation, and community development. As health and care workers, you may wish to engage in the process of community entry on an individual basis or as part of an organization or institution. The purpose of community entry is to initiate, nurture, and maintain a desirable relationship with the community with the purpose of securing and sustaining the community's interest in a specific aspect. In order to do so, the principles and techniques of community participation and community mobilization would be applicable as you would endeavor to establish rapport with the community, foster relationships of trust, and collectively conceptualize and plan a program. If the community entry is related to an existing program, all of the above aspects would still apply, and you would also wish to ensure buy-in by communities as well as agency from the community to the program. Knowledge of relevant program activities is necessary to ensure that you can answer questions about the program. Engagement in community life and attending community meetings are just some of the ways in which you can familiarize yourself with the philosophy, values, capabilities, and functionings within a community. In another session, you would have been introduced to the definitions of communities. Most often, this definition refers to particular geographical communities, but do remember that a community can also refer to a group of people with similar interests, a group of mothers with young children, or a group of diabetics at a clinic, for example. Community participation is the process of involving people about decisions that affect their lives. Community engagement is developing and sustaining a working relationship between one or more public body and one or more community group to help them both to understand and act on a range of social and organizational outcomes. Community participation can take place on a continuum from very passive recipients through intermediate stages of tokenism to active community involvement. Communities should participate in every step of community development projects to ensure that the planned changes occur in the community. This involvement promotes self-reliance, ensures greater control over their own health and social care through assessing their own needs, suggesting solutions, influencing infrastructure, technology, and even personnel of services such as health and social services. Communities should therefore participate and lead in the planning, implementation, management, and evaluation of projects. The official definition of community development has been formalized by the South African Community Development Practice Policy Framework of 2014. This definition finds expression in the National Development Plan Vision 2030 and re-emphasizes the approach of the Reconstruction and Development Plan to build active and sustainable communities. Community development can assist the movement of people from being passive citizens to active citizenry, social and economic inclusion, the development of people's capabilities to become active champions of their own development, and effective partnership between government and people working towards elimination of poverty and reduction of inequalities. Traditional approaches to community development were predominantly needs-based or the service-based model. Internationally and locally, it has been highlighted that there is a need to explore new approaches to working with and in communities, and this led to the revival and development within community development. In essence, we can recap that the new community building paradigm focuses on communities with its assets and opportunities towards empowerment. The former service model focuses on the individuals who needs services. The most notable difference can be seen in the last line in this table, where community building focuses on community led in partnership with outsiders, whilst the service model is outsider led. There are three models that can be used in community building. Education for Sustainable Development had its origin in the context of environmental ecology from the perspective of education for sustainability. As you can see from the outcome statements for ESD, there is a strong emphasis on providing knowledge that is locally relevant and culturally acceptable. That's all good. However, it should be noted that the ESD focuses on education of people. It mostly sees people and communities as not having knowledge that can be harnessed. This underpinning deficit model is the main criticism against the use of ESD beyond sustainability in the environmental discourse. The leading approaches for community building is a combination of the ABCD, or asset-based community development, and SLF, or sustainable livelihood framework approach. Asset-based community development is an approach to sustainable community-driven development which goes beyond the mere mobilization of communities by linking micro-assets to meso-environments and is extended by the Sustainable Livelihood Framework, which links the meso-environment to the macro-level actors. The ABCD uses methods to draw on strengths and successes in a community's shared history as the starting point for change. It pays special attention to assets inherent in social relationships. Note that assets are not merely seen as resources of economic value. From this base, people take action with power to challenge structures for their development and the manner in which resources are allocated. It links community level actors with micro and meso level actors in public and private sectors. A livelihood comprises the capabilities, assets, and activities as a means of living. A sustainable livelihood is when it can cope with stresses and shocks, when it can grow and be passed on to the next generation, and when it also benefits other livelihoods. The sustainable livelihood approach has 6 basic principles, which are being people-centered, participatory and responsive, dynamic, multi-level, holistic, and sustainable. The emphasis of community building is on community members being able to conceptualize their developmental factors and processes instead of being dependent upon action from outside. Instead of led by outsiders, the aim is to plan with outsiders for the community and its sustainable well-being. In conclusion, for sustainable development, communities should participate and lead in the planning, implementation, management, and evaluation of projects.